Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today is Tuesday, April 20th, giving you the update from Albany Med. All right, we'll pop open the first graph here. It's the Capital Region, 8 counties. Currently in the hospital, 111. And I think we say this every Tuesday. It's not really changing much.
It's not really changing much.
Right.
All the way back to March 5th.
Let's look at the next graph here. This is the morning census here at Albany Medical Center. So currently, Fred, 33 in the hospital, 23 on the floor, 10 in the ICU, 6 on ventilators. Of the 23 that are on the floor, 2 are under the age of 18.
That's
I think
right.
one's 11, one is 17. So we do have some pediatric patients. Thankfully, neither one of them are in the pediatric ICU. Probably about a half dozen that are no longer infectious in that 33.
That's right. I think it was 6 this morning, Dan.
All right, very good. Fred, we did the regional call today, and obviously it's a very similar area to the Capital Region, includes some hospitals out west and Fulton and Montgomery. What did we learn?
So it was an interesting conversation. So it's a few more hospitals. So the number this morning of hospitalized patients was 115.
Okay.
So a little bit more than the tight-end Capital District. But again, that number's been pretty flat, Dennis. Maybe a little decline, but not much. We had an interesting conversation about what's happening in the western part of the state.
Yeah.
So Buffalo, Rochester, even the Syracuse area, in the last couple of weeks have seen a spike in hospitalizations, about double what they had experienced at the trough of hospitalizations. But interestingly enough, on this regional call, we also have people from the VA here locally,
Right.
and they know what's happening across the whole VA system, across the state. And the western part of the state, the VA has not seen that kind of spike.
So in a subset of the VA
Yes.
population out west, not the same.
Not the same. And they told us that they have vaccinated more than 50% of their population. And so it suggests very strongly that the vaccine works, makes a difference.
We believe it does, and we've seen those numbers on this campus as well. When we look at the people who are admitted to the hospital, it's a very rare event when you come into the hospital and there's also evidence that you've been vaccinated.
So far, Dennis, 4 people.
Right.
So, and we've admitted a lot more than that.
All right, very good. So let's talk a little bit more about the vaccine. We have some exciting numbers. We've crossed over a threshold. So in those 8 counties of the Capital Region now, we can report 507,000 people have received at least 1 dose of the vaccine. So that's over 500,000, which is remarkable.
It's amazing.
And 364,000 have completed the vaccine series. So first number, 47% have received at least 1 dose, 34% are done. And Fred, that leads to the obvious question, people are watching the news, Johnson & Johnson, it's still on a pause. We know that the committee that looks at immunization practices is still studying the data.
That's right.
Is there any update?
Not really, Dennis. I think Dr. Fauci was on TV over the weekend. He's expecting that there'll be some news later this week, so we'll see.
We do know that in the last week, despite the fact that there was a pause with Johnson & Johnson, there was a lot of Moderna and a lot of Pfizer vaccine that was being given out in the Capital Region, which was great. A lot of efforts to change things around, but credit to those that are in the vaccination business. Fred, in addition to that, we asked some of the same people who were part of our campaign about vaccines and their safety and their effectiveness to come back in and talk specifically to the Capital Region about the pause with Johnson & Johnson. And we've done another video.
That's right.
And
we
so
have.
let's take a look at it here.
Let's go to the video.
More and more New Yorkers are receiving the COVID-19 vaccines. In the Capital Region, almost half of us have rolled up our sleeves. We are working together to end the pandemic.
You have likely heard about the pause on the Johnson & Johnson vaccine. We're here to talk to you about what that means, what we're doing about it as a community, and what you should know if you have already received the J&J vaccine.
Don't panic and don't hesitate. Vaccinate.
Don't hesitate, vaccinate.
Out of an abundance of caution, the FDA and the CDC recommended a pause on the Johnson & Johnson vaccine on April 13th. These organizations are looking into reports that 6 people out of 7 million who got the J&J vaccine also had blood clots. That is a very small number. This is very rare. The pause shows that we are totally focused on safety.
Our local clinics are focused on safety too. We are rescheduling any J&J clinics and will shift to using the Pfizer or Moderna vaccines as they are available.
These vaccines are highly effective at preventing the coronavirus. So, if you have an appointment, please keep it. The vaccines will get life back to normal. With the vaccine, we can open our arms to family and friends again. We can live without fear.
If you got the Johnson & Johnson vaccine, you shouldn't worry. There are some side effects with the vaccines, like a sore arm or flu-like symptoms. Those are normal and mean the vaccine is working. But if you feel a severe headache, a backache, abdominal pain, shortness of breath, or leg swelling, please call your doctor.
The CDC and the FDA, which authorized all the vaccines, may eventually lift the pause on the Johnson & Johnson vaccines. If and when that happens, you can know the decision was totally based on one thing: safety.
We have made so much progress, but we still have a way to go before life returns to normal. Remember, the vaccines available now are safe and effective. We are on our way to ending the pandemic together.
Our communities are counting on us. Don't hesitate, vaccinate.
So I think we can agree that's a very powerful video.
It really is, Dennis.
A lot of leaders in the community who are speaking to the safety and the effectiveness of the vaccine. And we thank those who participated in the video for your leadership and your community volunteerism. And we encourage you, if you see that video on social media, share it. Share it.
Absolutely, it's important. Thank you.
Okay. Fred, this week happens to be a week where there's several different groups that are being recognized for their efforts, and so we'll talk about a couple of them today and maybe a couple of them on Thursday. Yes. So I'll let you go first.
So this week is Lab Professionals Week.
Excellent.
Recognizing the hard work that the folks in our laboratories do, particularly in this last year of COVID. They've really done a tremendous job, so thank you all.
You know, the lab is one of those areas that every day reports out at the safety brief, and you know, as you stand there each day and listen to what we do collectively, it's a daily reminder of the great work that our lab professions do, for sure.
Amazing.
It's also tomorrow's Admin Professionals Day, so many of us are fortunate to have someone much smarter than us who manage our office and manage our lives. I know
that we'd be lost without.
I count myself among them. So yes. In my particular case, I want to thank Robin for her efforts, and to all of the admin professionals in our hospital and in the medical center. We thank you very much.
And I would thank Maria, and again, all the other admin professionals in the community.
For sure,
thank you.
For sure. Lastly, there's a new Facebook page out there that we would like to encourage you, if you're someone who looks at Facebook, to go out and look at. We think it has a really strong message about one of our very important missions.
And Dennis, that's the Children's Hospital here at the Medical Center, the Bernard and Millie Duker Children's Hospital. So it's a page of their own.
Page of their own, that's so great. A page of their own, so it's out on Facebook. I assume there'll be information in there about the services they're providing and stories about quality and safety.
News for children and parents, absolutely.
Yeah, so check that out.
Yes.
All right, so we're gonna come back again on Thursday, a couple more professions to recognize later in the week.
That's right.
We also want to talk about something we're doing with a joint venture with Nathan Littauer out in Amsterdam, which is pretty exciting. And that's going to launch soon, so we want to talk about that.
Soon.
All right, very good. All right, and maybe we'll have some information on Johnson & Johnson.
Yes.
We'll see. We'll be back again on Thursday. We ask that you once again please take care of yourself, take care of each other, and we'll see you in 2 days.